Widespread testing for COVID-19 is crucial in efforts to protect the public from this disease. The current gold standard for testing is a nasopharyngeal swab.
The nasopharyngeal swab is so uncomfortable. I know this firsthand because I recently took my 5-year-old daughter to be tested, and it can also cause people to cough or sneeze, which puts the healthcare worker at risk. And so Dr. Wiley and her colleagues really wanted to find a way to validate a test that would be non-invasive, easier to administer, and would also pose less of a risk to healthcare workers.
Dr. Anne Wiley of the Yale School of Public Health has been studying saliva as a reliable alternative to detect SARS-CoV-2.
So saliva is an incredibly easy sample type to take, especially in comparison to the nasopharyngeal swab. Both samples are tested the exact same way. We take 300 microliters of each and just put it through the exact same extraction process.
I'm one of the lead clinical investigators on the IMPACT Biorepository at Yale, which is our large research effort to understand many aspects of COVID-19, including aspects related to viral transmission and viral testing. So I and others in the hospital have been working to approach and enroll patients who are interested in participating in these studies. We then collect the various specimens, including nasopharyngeal swabs and saliva, so that Dr. Wiley and her colleagues can perform the lab testing.
The results that we were seeing for the saliva samples were, even in some cases, better than what we were seeing for nasopharyngeal. These were COVID confirmed in patients that we were initially testing, so they should have been testing positive for SARS-CoV-2. So it was striking to us that in a number of cases they were coming back negative when we tested their nasopharyngeal swab, but they were still testing positive when we were testing their saliva. We also have the healthcare workers who we enrolled into the study. So these individuals were at higher risk of exposure, obviously, to COVID-19. And actually, after repeated testing with nasopharyngeal swabs, they were still coming back negative, whereas repeated testing with saliva, they were still coming back positive. So actually, by using saliva, we caught it earlier. And what we're seeing in saliva is a much more sort of reliable and consistent detection over time.
The research is the result of a collaboration between the Schools of Medicine and Public Health, along with the Yale New Haven Health System.
Collecting a saliva specimen from someone is incredibly quick. It's easy for someone to do at home by themselves without exposing a healthcare worker.
It really just opens up a whole range of options and potential just to really increase our testing capacity.
In order for us to be able to go back to our normal lives, we need to be able to know who's infected and who might be carrying the virus within them while asymptomatic. So having a reliable, quick, easy test is going to be crucial for us to be able to lead normal lives again.